Hello, I'm Gina Gosted, and we're here today with Carrie. She injured her leg about 8 weeks ago, and today she presents with limited hip, knee, and ankle motion. At her hip, she's lacking about 50% of extension, abduction, and internal rotation, and on her knee, she's lacking about 25% of flexion and patella movements, inferior and medial movements. And her ankle, she's lacking 25% of her dorsiflexion, plantar flexion, and eversion of her foot. She says that she has got more stiffness than pain. So we're going to work at the higher grades today. We're going to start first just to help relax that leg and that hip. And I'm going to move into a distraction of her acetabular femoral joint. We're going to start with a grade 1. And that's just thinking about it. And then we're going to move into a grade 2, which is larger movements up to the resistance. And a grade 3, into the resistance with large movements. And grade 4, into the resistance, and then apply small amplitude movement to the joint capsule. And this helps relax her leg and increase range of motion of her hip. All right, now we're going to move into a gapping glide, lateral glide, to help with her hip abduction. I already explained to her about the use of the belt and the need for the towel. Give her some padding there at her hip. And we're going to apply this belt to give her a little bit more of a nice glide. All right, and so we're going to start with the grade 1 just to give her a feeling of what it feels like with the belt. That's hardly moving, just thinking about it. And a grade 2, larger movements up to the resistance. And a grade 3, large movements into the resistance. And a grade 4 into the resistance and small movement. Okay, and to increase her internal rotation, I'm going to do a little physiological movement of internal rotation as I gap. So I gap and then do a little internal rotation, relax, and gap, internal rotation, and perform that lateral glide and internal rotation. Good. How was that, Kiri? Good. Good. Next we'll move on to the patella. I'll remove this and slide this over to give you some support at the knee. Good. And we'll start first with the inferior glide of the patella, and this helps increase knee flexion. And so we'll go grade 3, large movement into the restriction, and grade 4, small movement in the restriction. Okay, and next we'll do the medial glide, and we'll start with a grade 3, large movement into the restriction. And a grade 4 would be into the restriction and small amplitude motion. Okay, and next we'll move on down to her ankle, and we're going to do an anterior-posterior glide of the distal fibula or tibiofibula joint. This helps increase her dorsiflexion. Okay, so I'm going to do large amplitude into the restriction, grade 3, and then a small amplitude way deep into the restriction at a grade 4. And increase the dorsiflexion. All right, now I'm going to help Carrie move over onto her stomach. And this here, we're going to do work on her hip joint for increasing hip extension. And we're going to do a posterior anterior glide. And we're going to start with a grade 3, large movements into the restriction. And now we're going to move into grade 4, move into the restriction and small amplitude. And I can add some physiological hip extension with that movement. Okay. Next we're going to move into the knee, to increase the knee flexion. At the tibial femoral joint, we're going to do an anterior posterior glide. And we're going to start with the grade 3, large movements. Into the restriction. And a grade 4, small amplitude motion into the restriction. And I'm going to add a little physiological motion with that to increase that knee flexion. Good. Next, we're going to move to the ankle. To increase the dorsiflexion, we're going to do an anterior-posterior glide of the talus. Okay, and we're going to do grade 3, large movement into the restriction, and then a grade 4, small movement and deep into the restriction. Okay, increase your dorsiflexion. Next we're going to do for plantar flexion, we're going to do a posterior anterior glide. And we'll do grade 3, large movement into the restriction. And then we'll switch to grade 4, small amplitude movement deep into the restriction. And that increases that plantar flexion movement. Add a little physiological movement there. And next we'll move to her subtalar joint, and we're going to do a medial glide to increase her eversion. So we're going to start with a grade 3, large movement into the restriction. And small movement, grade 4, into the restriction. Okay, thank you very much.